Okay, I think I'll get started. They're ready? Okay. I actually shared the slides really late today, so if you didn't see slides till now, it's now up in the Google Drive. So today's the muscular and integumentary system, which is like skin, connective tissues, integumentary. And we'll start with the presentations of organ systems and terminology for muscular system, terminology for integumentary systems, and we're also gonna cover different types of injections, which I think will be very relevant for whoever is thinking like a healthcare field. And we'll go over the case report one. So, oh, whoops. Uh, is Diana here today? Oh, okay. This is a slide, right?
Yeah.
So,
Cool.
kind of being on the spot, yeah.
Yeah.
Wait, do you have an account?
Yeah,
Maybe?
yeah, I can. That's good. I didn't think you'd have an account to.
Yeah.
Yeah, I can connect.
Or actually, yeah,
I
that
was
might be
just
better.
thinking. Yeah.
Okay. Yeah, I think if you just plug it in, should be. There we go.
Yeah, cool.
Do you wanna do with the mic in your hand?
Yeah, sure.
Thank you.
Let's see. Okay, yeah. So hi guys, my name is Diana. Today I'm just gonna be going like a broad overview of the muscular system. I know a lot of you in here are pre-med. I am not, so forgive me for any potential like inconsistencies or mistakes. I kind of just learned this as I was making the presentation.
Very low stake.
But yeah, I think I'll just go straight into it. So overall, the muscular system, broad summary, it's a fundamental like component of the human body, and it's essential for like enabling movement, maintaining stability, and ensuring proper like posture. And it's comprised of like three main muscular groups. We have like smooth muscle, skeletal muscle, and cardiac muscle. And each of these like muscles serve unique functions, which I'll go into later in the presentation. If we go back to, that's forward, but yeah, if we go back to like this general muscular diagram over here, you can see that there's a lot of striated muscle. A lot of the muscle you see here is actually skeletal muscle. Like you can see the abs up there. Above the abs, you'll see the pecs. To the right and left of the abs, you'll see the obliques. We have the quadriceps right here. And there's just a lot of like, these are just some of the like main visible muscle groups you can see, but I think skeletal muscle primarily is like what consists of most of the muscle we have in our bodies. Okay, and then, sorry. Okay, yeah. So now I just want to go generally into some of like the main functions, just a little bit more in depth, but still very general. One of the main things that the muscular system allows you to do is that it allows you to have voluntary movement. The muscular system allows for voluntary movement, allowing you to run, walk, lift weights. This movement is generally enabled by skeletal muscles, which allow that. They're made up of those fibers, those striations you saw in the other diagram, and basically allow you to contract or compress, which allows you to lift things, curl things. Yeah, they pull on bones, help you move voluntarily. Big on this is voluntary movement. Now, another key function of the muscular system is that it helps maintain your posture. This is more of a passive thing, but your muscles continuously work to maintain your posture, providing stability for your body so that it can function at its best. And yeah, it just relies on the coordinated action of multiple muscle groups. And another thing is that it produces heat. When you exercise, the metabolic processes throughout your muscles, like undergo when you exercise, contribute to thermoregulation and just maintaining your body heat. And this heat's especially important, for example, in cold environments or just during exercise. And then finally, it helps to support your skeletal system. It keeps your bones in place, it allows them to have a point of attachment, and it allows the body again to perform various functions effectively. Okay, And now I'm going to go ahead and move like more in towards those skeletal muscles, those smooth muscles, those cardiac muscles I kind of talked about earlier. So those skeletal muscles, like I said before, they're striated. They're made up of a lot of different fibers. Presentation. Oh. Okay, it's back. Okay, yeah, it's made up of a lot of different fibers. And it's made up of a lot of voluntary movements, and they're attached to bones, facilitating your movement and posture. Because they're striated, the contraction of these like different fibers allows you to like have more controlled movements. Now there is also the smooth muscles. They're not striated, and these are kind of involuntary muscles. They kind of work in the background. They're mainly found in like the walls of organs, and they control functions like your digestion and blood flow. Then finally, we have our cardiac muscles. I sort of think of these as kind of like a middle ground between skeleton and or skeletal and smooth muscles, because they're striated, but they also like it's a very involuntary movement. You don't really think about it. You're not consciously controlling it. It just helps to. It's responsible for pumping blood throughout the body, and these muscles are located in your heart. Okay. And finally, I'm just going to go into like one condition related to the muscular system. I chose muscular dystrophy, which is generally like a genetic disorder. And muscle dystrophy is a group of genetic disorders that's characterized by progressive muscle weakness and degeneration. It primarily affects like the skeletal muscles, which leads to difficulties in movement and mobility over time. And I just have a little diagram here. As you can see in the first guy, he has healthy muscle, but over time, like the muscle gets narrower, it's closer to the bone, it's a lot thinner, and that represents like the weakening and the breakdown of the muscle over time. And yeah, that's it for my presentation.
That was amazing.
Thank you.
Yeah. I would admit I was lazy on my part, and the reason I have this kind of organ system presentation is I didn't want to present everything myself. So thank you so much. But let's see, Daniel. Yeah. Did you want to present on your computer, or do you want me to?
It's just Google Slides.
Oh, okay, I see. Oh, there we go. Show. This.
Thank you. So I'm also not pre-med, so I had to learn all of this as I was making it. But so the integumentary system is mostly just stuff that's on like the very outermost layer of your body. It's comprised of like the skin, which is actually the largest organ in your whole body, which is cool. Your nails and nail beds, all the hair that's in your skin, like your hair follicles, and then various glands, most of which are in the skin. So, like there's sweat glands, and then there's two different types, eccrine and apocrine. Eccrine is for like sweating, like based on temperature, and those are like found in like your palms and your forehead, like have the highest concentrations. And then apocrine ones are like emotional sweating ones. They form during like puberty, and yeah, they're like have highest concentration in like your armpits and stuff. I just thought that was kind of interesting. And sebaceous glands are another kind of gland that's in the integumentary system. They produce sebum, just like oil. Helps like lubricate your skin. And then there's a few other ones, but those are the main ones. Integumentary system plays a bunch of like important roles in your body, most of which is protecting it from the outside environment. So like, for example, your eyelashes are like the hairs, so they're part of the integumentary system, but they like protect your eyes from dust that could get in there. Your nails protect like your fingertips from getting like smushed and stuff. But then your skin in general prevents like bacteria and chemicals and like anything that like could harm your internal organs from getting in there. Another important role of the integumentary system is sensory receptors. So there's a bunch of nerves in your skin and stuff that let you sense like touch, pain, and temperature, which are like important for navigating your environment. it also, through a few different ways, regulates your body temperature. So you've got like the sweat glands that I mentioned earlier that like produce sweat and then evaporates and it cools you down. But also the blood vessels in your skin can do like vasoconstriction, where they constrict based on like temperature, which either allows or prevents heat from getting out. And then the fatty layers in your skin also prevent like heat from leaving, so it keeps you insulated. And then it does a few other things, like it prevents water from too much evaporating out of your skin, excretes waste, so salt and urea are both in sweat, and then it also can produce vitamin D from sunlight. General structure. So the outermost layer is the epidermis, and the outermost layer of that is the stratum corneum, which holds in water, apparently. And the epidermis is the most important for like protecting you from like the outside world. So like if you get a cut that goes through your epidermis, even though you still have your dermis there, like you're still at more risk. And then the dermis is the layer right below that. It's got like your nerves, your hair follicles, blood vessels, stuff like that. Like all of the like internal structures are for the most part in the dermis. And it's got 2 layers within it that have different like structures and stuff. And then there's the hypodermis, which has all the fat and connective tissue, and that's kind of in charge of like keeping your skin attached to your muscles and the rest of your body. So one of like the important substructures of the integumentary system is a hair follicle. So the hair shaft is the part that you see. It's the part that like comes out through your epidermis, and that's all like dead cells. And then the hair follicle is the part that's underneath it, and that has a bunch of different parts in it. So the sebaceous glands that I mentioned earlier that produce like sebum, those are like attached to the hair follicle so that it can like come out through your pore. There's the rector pili muscle, which is kind of interesting. It's we don't really need it, but it's what gives you goosebumps because it like pulls the hair follicle up. But that's like what makes animals like puff up when they get scared. And then the hair bulb is like the alive part of the hair at the very bottom. And then the hair follicle receptor, which is at the very bottom, is the part that connects the nerves. So like if something brushes up the hairs on your arm, then you can feel it better. Okay, so this is the disease. I know we didn't have to do like medical terminology, but I thought it was cool that you could break the word down. So I'm doing ectodermal dysplasia, and you can kind of figure out what it means just from like the roots and stuff. So ecto, the first part is just like the outermost, and then dermo is like your dermis or your skin. Then ol is related to, so you know it's like related to the outermost layer, or to your skin, the outermost layer of your body. And then dys means like abnormal or like messed up. Plaso is to form, so it's like malformation, and then it's a condition. So altogether, it's like condition of abnormal formation of your skin. So what is ectodermal dysplasia? It's a bunch of different genetic syndromes. They've got like there's quite a good bit of variety between the different types of ectodermal dysplasia, but they all affect the ectoderm, which is like the outermost layer of cells in like fetal development. And so all of them affect the integumentary system a lot because of that. And common symptoms, even though it like varies between them, is a lot of people with ectodermal dysplasia will have thin hair, hair loss. So you can see that boy has like thin, really light colored hair. That's because the hair follicles don't form correctly. You can have brittle or misshapen nails. Varies a lot, but that's another part of the integumentary system. Smaller missing teeth, not related to integumentary, but still cool. And then one of the main distinctions in different types of ectodermal dysplasia is whether they have hypohidrosis or not, which is whether like their sweat glands didn't form correctly. And so hypohidrosis means less sweat condition. So your sweat glands don't work. yeah, I think that's it. Yeah.
Thank you. Yeah, really awesome that you put like some terms as well. I actually have some of the terms you actually put in here, which is really good. And oh, I was just actually curious. Does ectodermal dysplasia have some like, I guess like actual like direct harm to the person? Like you have like less lifespan or something like that?
If you hypohidrosis, it can make you like really sensitive to like fluctuations in temperature.
Mm,
So that can like impact you if like you're not careful, it gets really hot, then like they can like pass out really
that's not
easily
really
because
easy
they're
because
not
you.
sweating.
I see.
But otherwise, like they have sensitive skin, but it's not really like
Interesting. Thank you. Thank you. Okay. Uh, and awesome. Seems like we're on time too. Uh, yeah. Thank you for both Diana and Daniel presenting today. Um, so now we are gonna go over some terms related to those systems. First is a muscular system. So the combining form myo um, means muscle. So one example is polymyositis. So poly is a prefix that means many, like a polymer, and myo and suffix itis, which might be familiar now, inflammation. So poliomyositis is muscle disease with simultaneous inflammation and weakening of voluntary muscles in many parts of the body. So I think if you see the diagram here, every part that is like labeled red, if someone has like a polymyositis, those muscles are the ones that's usually like inflamed, which is pretty much like all your limbs. And I think it'd be very hard to carry on your daily life with such condition. Um, kinesio or kineso, maybe you can think of it as like a kinetics, like movement. It's a combining form that means movement. So one example is bradykinesia. So brady is a prefix that means slow. You might remember from the first lecture, bradycardia, like slow heartbeat, that brady. Um, kinesio and suffix ia. I actually forgot to add it here, but it's a noun ending. So bradykinesia is extreme slowness of movement. It's kind of vague how it is defined, but basically, you know how like old people kind of like tremble a lot and like they're like slow to respond and a lot of things like that. That's basically what bradykinesia means. Can have like changes in like facial muscles, little like bent forward, slow speech, reduced arm swinging, uh, some rigidity and tremor. So bradykinesia is basically like a disease of age, I would say. Tono, it's a combining form that means tone, stretching, or tension. So one example is hypotonia. So as Daniel mentioned, hypo means low or deficient. Tono and what is it? Oh, noun ending ia. So that means diminished tone of the skeletal muscles. So now I realize it's kind of like a grotesque diagram, but so normally like you should have some like tension to your muscles and like you would lift up your head like the baby would kind of like wiggle too. But if you have hypotonia, lack of tone in the muscles, the baby will kind of like just flex all their muscle like down along the gravity. And I'm not like too familiar with this disease, but I think it is some kind of like a genetic disease. I'm not too sure. Yeah. I think it's called like also like when the baby has it, it's called floppy baby. It's kind of like funny nickname. Um, taxo is a combining form that means coordination or having like an order. So ataxia, so prefix a means without. Taxo, the noun ending ia. So ataxia, lack of muscle coordination during voluntary movements. So maybe in the diagram to the right, you can probably see like his like swinging to the left and right. He can't really control his muscle voluntarily well. So that's how that's one form of ataxia. Or it could also be shown as like you wanted to move your arms out, but for some reason it moves in. I mean, adduction versus abduction. That is also one form of ataxia. Teno, tendo, or tendino is a combining form that means tendon, or it could mean extend as well, but I think it's mostly used as tendon. So tenosynovitis is the teno combining form, and synovo combining form is means synovial membrane, which is, oh yeah, you can see my mouse pointer. This kind of like a wrapping that's around the blue tendon. That's the synovial membrane. It is usually not this like thick. It looks like very thick because it's inflamed, but it's a membrane that surrounds the tendon. So synovial membrane, itis, inflammation. So tenosynovitis means inflammation of the synovial membrane surrounding a tendon. So as I said, you would see inflammation on that synovial membrane around the tendon, and tendon itself will be inflamed as well, actually, in the tenosynovitis. Yeah, I think it is usually, might not be true, but I think it is usually due to usually on the joints you use a lot, like your knee, or like your feet or ankle, or your wrist. That's where like a lot of like inflammation could happen, especially you overextended and like it kind of tore a little. So fascio is a combining form that means fascia or fibrous band. And one example is necrotizing fasciitis. It's a so fascio plus suffix itis means inflammation. So necrotizing fasciitis is bacteria when a bacterial infection causes a muscle fascia tissue and the subcutaneous tissue inflammation as well as necrosis. So I think you might remember necrosis as like a death of a tissue, like yeah, death of a tissue. And you can probably see like the left is the healthy skin, and to the right you'll see a lot of like gaps in between. There's like holes. Some vasculatures are like missing too, like the hair follicles are missing. So those cells are dead. That's why like there's like an empty spaces. And if you search up necrotizing fasciitis in like Google, it shows very grotesque images. So I don't recommend you do it. I didn't decide to, yeah, I didn't like put any like a real images here for that reason. But it's basically bacteria eating up your flesh. Yeah, I think it's called like a flesh eating disease too, which is kind of crazy. Not all bacteria can do necrotizing fasciitis, which is good. I guess. Fibro is a combining form that means fibrous tissue. So fibromyalgia is one example. Fibrous tissue. Myo, we covered as muscle. Suffix algia is in general kind of a pain. Algia means a pain. So fibromyalgia is debilitating chronic condition with widespread musculoskeletal pain and other symptoms. So here the definition fibrous tissue, fibro doesn't really like come into its meaning, but it basically means like kind of like all the musculoskeletal muscles are giving some pain, as you can see in the diagram, all the parts that are pink. Clono is a combining form that means violent action. And one example is myoclonus. So myo, muscle, clono, and noun ending suffix us. So myoclonus means quick involuntary jerking of a muscle or group of muscles, which is very typically seen during some kind of seizure. Like you would see people like shaking, shivering very violently. That is, in medical term, it's called myoclonus. Um, plagia is a suffix that means paralysis or stroke. So hemiplagia, hemi is a prefix that means half. Might have like maybe hemisphere, um, that kind of like half hemi, and suffix plagia. So hemiplagia means a total paralysis affecting only one side of the body. The other side kind of remains intact. So if you look at the diagram to the left, you can see the part that is like highlighted blue is the part that's paralyzed. So as in hemiplagia, but the other parts you can still move around, which is kind of like weird to think. But that can happen because of some kind of like blood clots. We will cover, I guess, next lecture. Blood clots in some kind of blood clot in cardiovascular system can be called like embolus. So if there's like an embolus in the artery that's heading towards the carotid artery that's heading towards the brain, and very unluckily it might remove like the blood supply, oxygen supply to that part of the brain which is highlighted in blue, and even that small area that got deprived of the brain, deprived of the blood, can cause you to have like a whole half side of the body to be paralyzed. So it kind of shows like how intricate your brain is. Yeah. And lysis is a suffix that means to set free, break down. So one example is tenolysis. Teno covered tendon, and lysis, break down. So tenolysis is a surgical release of a tendon from adhesions to scar tissue that limit movement. Sorry, I might have had to chosen a different image, but so just like a little explanation. The yellow part here is not like a pus or anything. It's actually like a fat tissue. You might think like your skin or your finger or like parts of your body are mostly like muscles or some kind of like a vascular system or like epithelial cells, but actually a lot of them are like fats, and which are even true for your fingers too. But anyways, yeah, if you accidentally have like a tendon attached to tendon like almost adhere to like your skin and it just doesn't come off, then like your, let's say that your finger will be like stuck in this position and you can't like bend it. So the only way to uh, really solve that is through surgery. You will detach that tendon from like the part that it's stuck to, which is kind of, hopefully it's done with anesthesia. um, ick, suffix ick, you might have seen before. It's a suffix that means pertaining to something. So atonic seizure, a means without, tono is we covered before, means tone, and suffix eek, pertaining to, and seizure is when, I think you guys probably know like what seizure is, but it's when like your brain has too much electrical activity and they kind of like, what should I say, burn the brain, and the brain just like stops functioning. That's what when seizure happens. So atonic seizure is temporary loss of consciousness and muscle control after an abnormal burst of electrical activity in brain. In other words, seizure. And when atonic seizure happens, it's also known as a drop attack. And the reason being is, so when a seizure happens, you lose all kind of like tension in the muscle. And if you're like standing up, like person that gets atonic seizure would just usually just fall from head on like straight to the ground, which is very dangerous. That hence the name, like a drop attack. So yeah, kind of like that. He lost all the tension, just like slump, fall forward, and is very important if like a tonic seizure happens. It's very hard to do, but if someone's next to, you have to like catch that person before he falls, or it can lead to like very serious, like a brain injury. Um, trophy is a suffix that means growth or nourishment. So atrophy, a prefix that means without, trophy suffix. So atrophy means weakness or wearing away of body tissues and structures. But when you call atrophy, it usually refers to your muscle. We would say like muscle atrophy. And so to the left is like a normal like human muscle. When you have like a muscle atrophy, your muscle will like decrease in size and also like the number of fibers and will be weakened. Okay, so those were all the muscular system terminologies. Now it's to integumentary terminology. So cutano is a combining form that means skin. So subcutaneous, I think you might have heard about this term before. Subcutaneous, so sub prefix that means under something. Cutano, skin. Um, suffix os, pertaining to. So pertaining to beneath the skin. So yeah, Daniel put it really well with the diagram. So the very top part, outer layer of your skin is epidermis, and down is the dermis. And beneath that, so until epidermis is like what we consider like a skin. Beneath that is the subcutaneous layer, which is these parts. Also, where you would find like a lot of fat tissues as well, adipose tissues. And also, feel free to stop me if you guys have any like questions or comments. I might have said something wrong. So, uh, dermo or dermato is a combining form that means skin. So dermatitis, dermato plus suffix itis, inflammation. So basically an inflammation of the skin. It can happen for two reasons. You either had an infection that could rise up your immune system and you will have like there's redness on your skin, or you have a genetic disease or some kind of like a predisposition that causes you to have your immune system attack yourself, autoimmune problem, like eczema or psoriasis. Those are also part of like a inflammation of the skin. And yeah. Yeah, this would hurt a lot. Yeah, this would hurt very bad. So oniko is combining form. That means some kind of nail, fingernail or toenail. So onychocryptosis, onycho combining form, crypto, like I guess cryptocurrency, like hidden currency. You can think of it that way. Crypto means hidden. Osis is suffix that means condition. So onychocryptosis, hidden toenail into your skin, which is ingrown toenail. And yeah, like the toenail grows into your skin, and I never had it fortunately, but apparently it hurts really bad. So if you start seeing your skin like trying to like head in towards your skin, I mean sorry, toenail trying to head in towards your skin, like get checked with the doctor ASAP, I would say. So myco is combining form. Myco is combining form that means fungus. Onychomycosis, onycho, which was a toenail or fingernail, myco, fungus, osis, condition. So it's a condition of fungal infection of the nail. And it is very like hard to think. Like there's probably not that much like nutrients in the toenail or like that bone structure, but the fungus actually lives inside that toenail, as well as they will, if it is kept like for longer, it will also grow into your skin. Then it becomes like a pretty big problem. You can enter your uh, circulatory system and maybe spread to other parts of body. Then it's gonna be very hard to treat. Um, but yeah, and if it's infected, usually it looks like that yellow toe with like a very deformed edge. That's how you tell someone has onychomycosis. Also, fun fact is fungus is very closely related to human cells. So unlike bacteria, which you can just like easily treat with antibiotics, I mean there's antibiotic resistance, but there are like a lot of antibiotics available. Uh, what kills fungus also a lot of times kills human cell as well. So there's, if I'm correct, there's only 6 to 7 antifungal drugs out there, like only those, and not much research is done either because, of course, like people will be more interested in like a human stuff than like a fungus, which is very sad and also like dangerous. I think similar to bacteria, like they can gain like some kind of resistance as well. And if you have only 6 or 7, if they gain resistance to all of them, that's kind of like the end of the world. So yeah, just interesting facts. If anyone wants to do like a fungus research in the future, that's like a good, I guess, pride to have. um, SIBO is a combining form. SIBO is combining form. That means sebum. So sebum, as Daniel explained, is a natural oil lubricant that forms protective barrier against dehydration and pathogens like bacteria and fungi. You know how your like face can get a lot of like oil, especially around your nose. Those are all like sebum. And yeah, a lot of people like think it's like just very annoying just to have like a lot of oil in your skin. Like, why does your body even make this oil? But it is very important in protecting that epidermal layer from some kind of infection or any like dust or any kind of like stuff that could like fall in your skin. Seborrheic dermatitis. Oh, maybe I should probably like touch this one first. So in the diagram, that's kind of like two big bulbs sticking out of the hair follicles. That's sebum, and sebum, that oil is secreted by sebaceous. Am I pronouncing it right? Sebaceous gland and sebaceous gland. I think that's all right. And those sebum will be then released to the epidermis. So seborrheic dermatitis is seborrhea. Remember from diarrhea, like a flow or discharge, ick pertaining to, and dermatitis, inflammation of the skin. So it's an inflammatory scaling or itching dermatitis, often linked to the sebaceous activity. So if you release too much oil or too less oil, that could be one as well. Pio is a combining form that means pus. So one example is pyoderma. Pio plus dermo, which was skin, and suffix a, noun ending. So pyoderma is a pus-forming bacterial skin infection. So I personally think it should be named as pyodermatitis if it really was to refer to infection. But let's see. This is like a healthy skin. When you get bacterial infection, it can enter through. So this area, that yellow lining, is actually open and connected to the outside world. It's a external portion. So this part is actually touching the outside area. It's not inside of the body. So bacteria can enter through that and then can start infecting nearby cells, resulting in pyoderma. Righted O is a combining form that means wrinkle. Rightedectomy, righted O plus the ectomy, which is surgical removal. So rightedectomy is a surgical removal of excess skin to eliminate the wrinkles, which is more commonly known as like a facelift. So basically a facelift surgery. It's called rightedectomy. Yeah, you would like kind of cut out this portion that's like just hanging down, and you'll like merge this together like that to remove the wrinkle. Zero is a combining form that means dry. So xeroderma, zero plus dermal skin plus noun ending. So xeroderma is abnormally dry skin. And yeah, as you can see, a lot of wrinkles and very, very unhealthy looking skin. So that's like xeroderma, very dry, abnormally dry skin. Melano, it's a combining form that means black or dark. So one example is melanocyte. So melano plus cyte is a suffix that means cell. So melanocytes are melanin forming cells, and those are mostly in the skin. I think this diagram kind of shows like where it is. If that's like a whole like skin layer, if you like zoom in, it's kind of like hidden like under here and like a dermal layer. Is it epidermal? Epidermal layer. Okay, thank you for correcting. Yeah, epidermal layer. Um. Oh, and there are some like I guess also like fun fact is cancer of melanocyte is called a melanoma. Oh, really? Interesting. Interesting. Yeah, I didn't know that. That's cool. Uh, lip O is a combined form. That means fat or lipid. So example is a lipoma, lipo plus oma, which means tumor. So it's a benign fatty tumor under the skin. So do you guys think lipoma is a cancer or not? It's like a pop quiz. I don't think so because it's a benign means it's localized to one area, and there's the opposite is the malignant. Malignant tumors are kind of like the stereotypical cancer phenotype, like the ever proliferating, keep dividing, they don't die. So actually tumors, not all tumors are cancer. Yeah, I think that's like something important to like take a note of. It's any kind of like a overgrowth or like big massive skin can be called cancer. I guess like that lipoma over there, it's like a overgrowth of like a fat tissues. But unless it becomes a malignant tumor, it'll kind of like stay like that for the rest of your life, most likely, or they will just die and like get removed soon. So when the tumor becomes malignant, then it is a cancer, kind of. Yeah, I think it would become sarcoma. Yeah, sarcoma is a connective tissue, right? Sarcoma. Yeah, I think it becomes like sarcoma. So yeah, lipoma, at least in the state as it's shown in the diagram, is not cancer. um, remember in the presentation earlier, hypohidrosis was brought up. Uh, this is like a opposite of that, hyperhidrosis. So hydro, I guess it's like pretty intuitive. Sweat, like water. Hyper means prefix that means excessive. Hydro plus condition that means suffix osis that means condition. So hyperhidrosis, excessive sweating, and as you can see, people with hyperhidrosis actually sweat that much, even without like any kind of like heat or you're holding your hands together. Without those kind of things, they would just like sweat a lot like that. That's hyperhidrosis. Hirsute O is a combining form that means hairy or rough. You see, it usually means more of like a hairy. So hirsutism, hirsute O plus suffix ism, like a general condition. Hirsutism is excessive body or facial hair in women that resembles a male hair pattern. So it's usually due to like a hormonal changes. You will have like hair growing in like the under your chin, maybe like almost like a beard, and that is not typical for women to have such things. And so yeah, that is called hirsutism when a woman has like a very excessive body or facial hair that more resembles like a male kind of like a hair growth. Pili, oh, I forget. Pili I or Pili O. Is a combining form that means hair. Erector pili. I think it was brought up during the presentation. So erector, like arise, arose. Erector, to raise. It means to raise. And pili is a hair. So erector pili is tiny muscle fibers that make hair stand up, producing goosebumps. So this is that muscle, erector pili, and if this contracts, it will make the hair upright, and you will see like your hair like standing up. Or you would also see goosebumps because of actually this skin part like bumping up. That those are the goosebumps. Utric O is a combining form that means resh. So utricaria, utrico plus suffix aria. I think we've never seen that yet. It's a suffix that means connected with something. So utricaria is hives with itchy wheels from an allergic reaction. Actually, I'm not too sure why it has like a suffix aria there. But yeah, that's the term, utricaria. So it is also known as hives. You will have big redness on your skin. Um, I actually worked in like a allergy clinic a little bit, and they actually measure. There's like a quantitative like measure for like the allergic reaction, like depending on like how large like the size of that redness is. That's like one measure, and even though like the redness might be large, the bump itself might be like smaller than the usually like smaller than the redness. Like I guess these parts would be like the bumps. It's called wheal in the medical field. So you would measure like the redness and the size of the wheal. Uh, I was doing like a 64 panels. Like on the back, you would just like so what you do is like you have the person like sit showing their back, and they will actually have all their clothes off. Like we make them wear like a protective cover sheet like from the front, so they don't feel like too embarrassed. But you would write down like a number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, like kind of goes on like that. The one I did was like 60. You would write out all like that, and there's like a pick that is pointed like a fork. It kind of looks like this, and this part's you poke the skin just right until like dermis layer, like very almost like mostly like epidermis layer, very top layer. So you don't like go very deep. It's like a very close to the skin. So like poke it, and maybe like 30 minutes later, if you will test for like different kind of like you poke it with like a different kind of like allergens, like solutions. What should I say? Dipped into the pig, and then you'll poke every one of those like numbers, and like 30 minutes after, you will take a look. There's like a what's it called? Like a measuring tool or like a chart. It's actually I'm gonna search it up. Uh, oh, I forgot what it's called. Yes, these kind of things. Allergy rulers. Okay, that's what it's called. Yeah, this is like what I was saying about like the redness. You will like fit these holes to that allergy area, and depending on like the size of the redness, it will call like, oh, this is like this size, this is like this size, and the above is like the size of the that bump, like the wheel. You'll measure with these parts, and oh, okay, it's here too. Yeah, these are the picks used for picking, or there were like ones like this too. You can just pick multiple at the same time. Yeah, yeah, kind of like a side story. That's how like a allergy test is done. I think these days it's more like the place I was working at was like very small one doctor clinic. I think usually it's now like you have like a whole connected uh, picks. Like you just have to like stamp it on the back, like the back that big one pick. I mean, pi big one with like a multiple pigs attached to it. I think that's how it goes now. These days. Uh, cryo is a combining form that means cold. So one example is cryosurgery, cryo plus suffix surgery. And cryosurgery is destruction of abnormal tissue using extreme colds, such as liquid nitrogen. This is used a lot of times if you have like some kind of like infection or like a lipoma was there too, like some kind of like a mass. Then you would like use liquid nitrogen and just freeze only that part. And you know how like frozen stuffs are like pretty brittle. You can like break it out and it just comes up very easily. Kind of like that, you will just like break and like chip off like that skin and remove it out. And I think this would be pretty interesting. So types of parenteral injections. So does anyone have a guess like what parenteral means? So the part is a para, like surrounding, and teral is the basically like all your cavities on the upper side of the body. Remember in the second lecture we covered like a abdominal cavity, chest cavity, and stuff like that. All those parts are called like enteral region, and parenteral is uh, surrounding that area. So which is skin, blood, vessel, muscle, stuff like that. So, oh, yeah, actually, never mind. I was wrong. It's yeah, it's when in something is taken into the body or administered in a manner other than through the digestive tract. So anything in the digestive tracts, if it's not delivered to your digestive tract, so I assume it's oral, then it is parenteral. My bad. My bad. Um, so intradermal is one type of injection. I think that's the one to the very right. You will be very, you'll like angle your syringe like very close to the skin, so you can get that dermal layer, which is right below the epidermis. So intra, within, dermo, skin, and pertaining to al. So you will, it's giving injection into the dermal layer. And some examples of intradermal injections are tuberculin test. Yeah, if anyone has ever got tuberculin test, it hurts really bad. So any kind of like intradermal injections actually hurts really bad. I don't know exactly why, but you will you will inject like the antigen for tuberculosis into that dermal layer, and like a day after, or yeah, I think usually like a day or two after, you will go back to the clinic and they will check like if there's like some kind of reaction. If there is, uh, that means you are immune to tuberculosis because you have like a antibody that is like targeting that antigen. Um, and also some allergy tests can be done intradermal. I think back then it used to be like that allergen solution intradermally into the dermal layer injected. But then if you want to test for like multiple, it'll be very painful for the person who's getting it. So now mostly people have moved to like just like pricking or like a blood test for like antibodies and stuff like that. Subcutaneous, remember subcutaneous layer under subcutano plus os. So into the subcutaneous layer, some subcutaneous injections include insulin. If you have diabetes and needs to get insulin injection, usually do it yourself, but you'll angle it. I think it's around 45 degrees. That's subcutaneous. Yeah, and that will go to your subcutaneous layer. Some vaccines, such as MMR vaccines, are also subcutaneous. Intramuscular, so this is injection into your muscle, and these are mostly a lot of the vaccines you get will be intramuscular. That's why you get like a sore because like it's irritating your like muscular nerves. But some examples include flu vaccines; those are intramuscular. EpiPen, when you have like an allergy attack and need to inject epinephrine to lower that immune reaction, that also goes to kind of your like thigh muscle. Intravenous is a injection that goes into the vein, veno, combining form that means vein. So intravenous is some intravenous injections, or actually not injections, but more like some kind of like transfusion that's you want to like keep the blood circulating, remove the waste and stuff. Pain meds such as morphine, if you need to bring it very quickly to your system, uh, intravenous route is used, but it is delivered too quickly. I think the order is like intravenous is almost like immediate, like few seconds. Intramuscular, little slower than that. Subcutaneous, slower than that, and intradermal, even slower than that. It kind of like goes like that order of like how fast it acts. Intraperitoneal, this might be a little new to everyone. So intraperitoneal, so peritoneal is a combining form that means peritoneum, which if you see that yellow highlighted region is the peritoneal cavity, and kind of like surrounding that is the membrane called the peritoneum. So intraperitoneal is an injection that goes into the peritoneal cavity, and this is actually mostly used only in like a research fields working with like a mice models. You will, if you give like a drug administrations, it will be given mostly only in like an intraperitoneal region to the mice. Yeah. And okay, I'll be pretty quick. I think I spent too much time sidetracking, but so this was the case reports. How did you guys like the first case reports? Was it interesting? Yeah, I think it was very interesting. It's okay. I guess I'll go over it now. So osteoporosis, vertebral compression fractures. I think that was the main diagnosis this person got. So let's break it down. So osteo means bone, pore, suffix that means pore, osis, condition, plus vertebra, al pertaining to, so osteoporosis vertebral, and then compression fractures. So it's a small crush or collapse in a spine, that a spine bone that happens due to loss of bone density from osteoporosis. So this basically means like osteoporosis was kind of like already predisposing this person to have some kind of fracture because lower bone density, it's easy to get it broken. It's usually more common in like oh, so OCVF is the most common osteoporotic fracture in the aging population. Up to 50% of the people over 80 actually get OCVF, which is very high number. And compression fractures actually look like that. So left is a healthy spine, to the right is the weakened spine, and there will be like a fracture. As you can see, like all those like lines kind of telling that's like a fracture, and you would get like some inflammation there too because uh, those bones will can like press on your nerve, something like that too. Uh, Common triggers of OCVFs are just minor stressors. You can like accidentally like fell too hard, especially like older people. That might be very dangerous. You can like easily get fractures from that, especially if you have osteoporosis to start with. But then this paper, I mean, this case report was actually about a OCVF that happened as a result of electric shock, which I did not know if it was even possible to get a fracture due to some kind of electrical shock. It is a lot of pretty strong electrical shock, I think. Yeah, 480 volts. But even then, yeah, it is very hard to think that this could lead to fractures. So the premise of this case report was it's very important to like look everything very holistically when treating patients. You cannot like assume anything. Yeah, I think that's what the authors were saying. Yeah, it's very easy to overlook a vertebral fracture as a possible diagnosis. So, okay, I will actually. Oh, I only covered this one. So you might have noticed like a very weird term, tetralogy of phallids, in that paper. I didn't know what that was either, so I searched up, and it's apparently uh, tetra four means is a prefix that means four. Ology, a study of. So it's a condition in which when you're born as a baby, the baby has four different abnormalities in the heart at birth. That's apparently a tetralogy of phallids. So it could be either overriding aorta, stenosis. Remember the stenosis, narrowing of the of something, and this time it's a stenosis of the pulmonary trunk, right ventricular hypertrophy, like hyper, excessive trophy, gross nourishment, so thickened muscle in the right ventricle, ventricular septal defect. This should usually be connected. These blood should not flow together because this part is deoxygenated, like kind of like a waste blood. This part is like a new, fresh, oxygenated blood, so those should not mix. So you see like those four different types of like abnormalities coming up. I think it could be different combinations too, but when you have like four different uh, abnormalities at birth, it's called tetralogy of Fallot. So I will skip this part, but feel free to take a look. I kind of highlighted terms we did not cover, kind of like a new terms, such as femoral and metabolic as a purple highlighted. So those you can referred to them. The tetralogy of Fella was that too, and I kind of defined a few terms that comes up from the case report. These are the quotes from the case reports, and this is not all of them. Yeah, you guys like did a very good job finding all the terms. So I wanted to save some time to sorry about the first two people who've presented today. I should have done this earlier, but I think it would be great if I allow you guys some time to talk to your group members who you're presenting with. Maybe share some contact informations. Yeah, introduce yourselves. Share contact information. Make a group chat. That would be great. Uh, yeah, I think it would be better than like contacting with like emails. And you guys should divide work among yourself, but I would say everyone should be speaking at least once during the presentation. Yeah. So feel free to group up, find your people. Or actually, should I pull up this? This might be easier then. Okay. So I guess you guys can find people by like the group name and call out for the group name. Oh, yeah. Oh, oh yeah. Um, whoever is like presenting alone or like, I mean, I personally think it's like better to talk to each other, like especially like if you're gonna present together. But yeah, feel free to uh, head out. That's the end of the stuff I have for today. Actually, did you fill out the attendance? Yeah. Okay. I think attendance sheet is somewhere around. Thank you. Oh, I'll just put you.
Yeah, it should be good, right? Since I already.
Yeah, yeah, yeah.
Yeah, cool. Thank you.
Yeah, thank you so much for presenting today. Oh, damn. Oh, I see. Yeah, but there should be like email, so I think it would be possible to. Oh, I see. Oh, okay, no worries then.